I want you guys to actually go home and write this down. And if you have to take it into an NBME with you and put it on a piece of paper beside you and say, what is within my control is this block. What is out of my control is the previous block. So I can't let that get into my head. What I can do is do well on this one. And what I can do is read every question fully. What I can't do is wish that they'd given me the temperature on this patient, right? So things like that are, it really, and having it beside you, I'm a big like daily affirmations or like test taking affirmations person too. Like writing, I do know this. I do know a lot of things. I just need to apply it. Sometimes just seeing that while you're taking a test can be really helpful. So seeing this while you're taking a test, I think can also be like really helpful, especially for those of us who are, you know, a little bit anxious. You know.
And it's one of those things too, if you make it a habit, it will help prevent burnout to a certain degree. And I give a good example. Whenever I discharge my patients, I usually dictate my discharge instructions, and they go something like, return to the ED for worsening chest pain, shortness of breath, blah, 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 or other things that concern you. Follow up with your primary doctor in a week. We hope you feel better soon. And I could easily turn that into a dot phrase. Everything else in my life is a dot phrase or a macro. But like, I try and leave that to be ad hoc because it reminds me why I'm doing it every time I send someone home. And it's a small slice of gratitude before I have 4 people that just got put into my ER, so I now have to go sprint and see them. So like, find your affirmation thing. And science says if you don't make it a pattern and don't make it a rhythm, you won't use it. For me, discharging people was my rhythm. So it's a beautiful thing to get to send someone home. And then I get to celebrate it with a little bit of, we hope you feel better.